Many children and youth are exposed to violence in their schools, homes, and communities. They're eyewitnesses of abuse and victims of abuse. Here to talk with me about the social implications of the violent behaviors on our youth, Center Manager for the Teen Hub, Mr. Rory Roberts. I'm Kediesha Watkis, and this is the Wellness Beat. Hi Rory, how are you?
I am doing well.
Very good. Let me first say congratulations, because we just recognized 5 years since the COVID-19 pandemic, and I heard some great things that the Teen Hub accomplished 5 years ago when we were in such a vulnerable time. Yes. For those in the audience who don't know what the Teen Hub is all about, explain to us what it is and who accesses it.
The Teen Hub is a safe space for youth and adolescents. We offer a wide variety of services for young persons for free. Mental health counseling, guidance counseling, career counseling, free printing, so students can come and access printing for their SBAs. HIV and syphilis testing as well. We do distribute condoms and have rap sessions with young persons. We have different stakeholders as well who come in and have conversations with these young persons. So as I said, it's just a safe space where young people can come and express themselves freely.
And you said two very important words, safe space. You know, as the Ministry of Health and Wellness, we are big on championing mental wellness, especially among our adolescent population. I mean, from your vantage point, how vital is it that we have safe spaces like the Teen Hub for our youngsters? It
is utmost important. I think when you're in your adolescent phase, it's the most judged phase of your life. You're finding yourself, you're discovering who you are, but sometimes these things comes with a lot of stereotype. For example, access to health care. Some of these adolescents want information on STIs or even family planning and stuff like that. So they don't have spaces where they can go for these things, because if they go into spaces where adults are, majority of the times they are being judged. Where she are there, so where am I there, so why am I do that? Why am I look for condom? Why she ask for family planning? So it is important to have spaces like these where young persons can freely and openly access these services where they won't feel judged or stereotyped.
And speaking about those safe spaces, it means that you're one of the first persons that they interact with inside of the hub. So you will be recognizing and observing their behaviors. When it comes to violence and exposure to violence, are there any observations that you have made with those who access the hub?
Several. As I said, it's really a safe space, and it's not just a term that we use. I see it every day. So sometimes we close at 5, but several days after we're running them out because they don't want to either go home or they don't want to go to their communities, because the reality of it is, and I'm not bashing any specific community and I'm not bashing any specific household, but a lot of the time the first experience of violence is from either the household or from the community. So I've heard many stories. I've counseled many young persons who have faced several instances of violence. And as I said, sometimes it's from the home. The implication of this, I have a lot of young persons who self-harm. I have a lot of, that's how they express themselves. So that's one of the main issues I'm facing right now with these young persons, where they cut themselves, burn themselves. And when you ask them why, you'll realize that that's the only way to get rid of their pain is to inflict pain to themselves. So I've heard a lot of traumatic stories, or I should say traumatizing stories.
Yeah.
And to me, it's sad because, as I said, a lot of the times it's coming from persons who should be protecting them.
Yes, yeah. Yes. So the homes, which should also be safe spaces, sometimes that's the place that they're running away from.
Yes, yes.
you know, you've touched on some important things, and I'm thinking also about our male, our female. Is there any kind of breakdown that you can give? Do we have a sense of, is it some more of our males being impacted, more of our females? Is it more male than female? That kind of thing. And you let out a big sigh there.
I would just say it's more male than female, but you know, females are more socialized to be expressive. So it's kind of hard to get it out of the males. But the females will express their stories very freely. Sometimes I have to dig deep. However, based on observation, I have a lot of males coming in at the teen hub. And this is where the issue kind of starts. They are not going to come there being saints, you know. They're this stereotypical bad boy behaving, but the truth is that's who we really want. They won't tell you that they are running from something, but you can tell. As I said, a lot of many days I have to be home time, you know. Sometimes though, based on where the hub is, I don't know, I didn't say, but the teen hub is located at Half a Tree Transport Center. It's a very central location. So we have security guards there, we have police there as well. A lot of the times they don't want to really see the boys in the hub because they want them to be home or in the communities. But when it comes to behavior change, you can't send them where they're being affected, things are happening. So I prefer to have them in the hub where I can observe them, where I'm seeing what they're doing. Because a lot of the time, as I say, it pains me because even when I send them home,
you know you're sending them into some terrible
situations. Or they're
situations.
not going home. Them gone on some ends, gone somewhere, gone do God knows what. So just to answer your question, I think I strayed a bit, but just to answer your question, I think it's equal in terms of in the demographic, male and female. The age group is still similar in terms of 12 to 18, 19, thereabout. But what I really want more, and I will try, is to get the young men to express themselves more. Girls will express what they're going through more freely than the boys.
So it's a safe space both for male and female, because we must understand that our men are struggling with some things. Our young boys, they need that safe space as well too. And so I'm thinking, Rory, you have a number of hours with these youngsters. What does it call for from you or other adults, guardians, to attend to their needs? What are some of the things that we need to be doing to help them?
We just need to be more realistic as adults, stop being hypocrites. I think about it. You're in a household where you develop these violent traits. Your mother probably arguing, father is probably absent, the household is violent, but these are the same people discriminating against you because you are violent. You know, it left some level of confusion for these young people because you teach them this, you create this monster, then you want to ostracize this monster. So I just think adults should be a little bit more empathetic. We are not empathetic as adults, we more judge. It's almost as if we weren't teenagers, we weren't adolescents. You know, we drop from sky and become adult and we're all perfect. And now we're looking at these young people and then they're all demons. So instead of demonizing these young people, especially our boys, is try to understand them and try to be a little bit more empathetic and find ways in terms of getting them to express themselves where they can freely speak about what they're going through, because mental health is a big issue now for these young people. So I just want us as adults, stakeholders as well, to stop being so judgmental, allow these young people to have spaces where they can express what they're going through or speak what is affecting them.
So we need that empathy.
Definitely.
And understanding mind and just being open to giving the kind of support. Yes, and I'm thinking, what else can we do to support them, even beyond the hub? So when they go home, what can we do? We
need some parental workshop. A lot of the times, what will happen is that we try to target we try to deal with the issue directly. So John is 16, he's being problematic, having behavioral issue. we try to target John, but not target where the root problem, the root cause. So we have to target the parents, we have to target the communities, we have to target the churches, we have to target the youth club. So it's not just addressing these issues directly with these children or these young people, but to address the issues that surround them. And I'm going to give an example. Like a month ago or two, I was having a car issue and I was on the bus. And listen to me, I was shocked. I'm looking around, I'm seeing probably like at least 6 kids between the age of 8 to 12. And the songs and the conversation. And I'm wondering if I'm in a different world, because where I grew up, certain things you don't discuss around children, you don't expose children to certain things. And everybody's just so comfortable with the lewd music, the violent conversation. And these children are just sitting, soaking things up, right?
Yeah.
So we need to have certain training workshops for parents, for adults in general, guardians in general, where they can understand that there's a difference. You don't, because we're teachers. Teachers aren't in schools. We're all teachers. And once we say these things, do these things, they'll mimic them, you know? So we need to, as adults, understand how we socialize or how we interact around or with children.
Yeah, and that's an excellent point to wrap up on, the fact that we all are teachers. So it's going to take an all of society approach for us to really respond to the mental health crisis unfolding among our adolescent and youth. Such a pleasure to have you, Rory. I was telling someone backstage that you can't miss the Teen Hub when you go inside Halfway Tree. It's a colorful place, right? So once you see those bright colors, you know this is a space for teens.
Definitely.
I want to just congratulate you on the excellent work that you're doing, fostering that safe space for our adolescents. Rory Roberts, Center Manager for the Kingston Teen Hub, our guest today, the first of 2 guests here on the Wellness Beat. Stay tuned. Our next guest, Dr. Judith Leiber, she will be talking to us about the clinical side of things as concerns caring for our adolescents. Thanks for staying with us.